Questions? This way, everybody.
Okay, there's been some, I don't remember exactly what they're called, but they advertise these things where like you'll get a community will pay money into a pool. It's not exactly insurance, but it works in a similar manner. Everybody pays in a certain amount, and then but you're allowed to make claims against it. Yeah. Medishare, that's it. Okay.
Oh, you can use the mic on the stand. Use the singer's microphone. Oh, okay, now. I had it muted.
It's
So
on
now it's okay.
Okay, yeah, so that's more, it sounds like I'm not involved with that type of concept, but it's like a self-insured model typically where people, they form their own like insurance company, they put a pool of funds together that claims could be drawn against. They probably have certain levels of benefits that it'll cover. And most of those, when we try to do self-insurance, like with companies, they have enough assets, instead of buying insurance from outside companies, they form their own self-insured. But important for them is they do what's called reinsurance on top of that, right? So if there's someone has a massive claim for $1 or $2 million that would blow out that pool of money, what they do is that reinsurance will help kick in after a little while. So, and it's just a myth here for everybody. It's not a myth. Insurance companies are insured. They do reinsurance. So the model you're looking at, I think even there's a church program, right, that people that are members of certain churches, they can join these consortiums where they're essentially taking on a self-insurance approach.
And just to add on to that, speaking on the church piece, what they'll do is they will, in terms of what's covered on the insurance policy, it will align with maybe the religious ethics behind. So, you know, if with traditional insurance, it might cover procedures that maybe are against particular religions. You can buy into the whatever religious organization's self-insurance pool, and you will only cover what aligns with your values.
Oh, so I have a question for you, Tim, Warren Kusamoto. Say on the residential care facility for the elderly, that's covered under federal law as well as state. And do you see much resistance from the municipalities in setting those up? Because I know in our neighborhood, we had a sober living home going in, and it was under the same act. So I had a question on that, setting one up. Great question, Warren. I think what's happening in different municipalities, it really depends by, I think, the leadership. We live in the city of Orange, and they're very senior care friendly, senior home friendly. So we go through the planning office, we work with them. You know, there's a facility component, but our license ultimately comes from the Department of Health Services in California. So they somewhat connect, but the city can make it, as you said, either difficult or easy for a 6-bit RCFE to be opened up in their communities. And you're wise to make sure you check with your neighbors if they're okay, because there's like senior care, it's pretty innocent. Seniors, they don't party hard, they don't have a lot of visitors, but then you have addiction.
You'd be surprised.
Well, yeah, some of them do. But there's addiction rehab homes now popping up in neighborhoods, and gosh, those are different elements. Not that we really do need them, but gosh, sometimes little neighborhoods and things aren't the right places because the elements that come along with that. So I think in general, senior communities are a little bit more community friendly, plus their tax bases too, they bring in, right? And they don't bring in the distractions. But in our situation with my mom and dad's, we definitely check with the neighbors and let them all know. And boy, most of them say, hey, what about, can my mom and dad come over there? And some even offered to volunteer. So again, great question. It's not for all communities, but in some communities, they're very favorable of that. But when it's your neighborhood, even smarter to make sure your neighbors won't be taken aback, because they can make life miserable if you try to do that.
Other questions?
The difference between a will and a living trust, I was wondering if you can maybe talk about that a little bit more as far as what the difference is. I don't know much about what a living trust is, although I hear a lot, it's everybody's always, oh, go for that, but I don't know the difference.
Aside from the spelling being different, I know a little bit more than you, but there's a gentleman right behind you I think I'm going to refer to our legal counsel over here, Mr. Bill Oy.
I can take that. Yeah, so what a will is it's, a will doesn't avoid probate court. So probate court is that's the big issue that a lot of people have when they pass away, is they don't want their beneficiaries to go through probate court. Probate court typically has mandatory fees that the courts charge, and there's excessive wait times. And I mean, I don't know if anyone's had to contest even a traffic ticket. I mean, it's like worse than going to the DMV, but unless you make an appointment. That's actually a great tip today. Make an appointment. So I also heard that AAA, you can do your DMV stuff at AAA. But anyway, I get sidetracked. So a will, what it does is it provides direction in probate court. You still have to go to probate court with a will. And so you still have to pay the fees and wait, but it is an easier process once you do get in, whereas a trust completely avoids probate court. So that's high level, the main difference. And then a trust allows you to do designate a variety of other things, not just the disposition of your assets. It involves, who's going to care for your kids and who gets what, and under what terms can your kids take the money. If you have young children, under what terms you can really define anything. They become the owners of the assets.
Can I? Oh, okay. Tim, I think, mentioned this, but related to the living trust, the durable power of attorney. It was something that Tim helped me understand. I talked about it with Miles Yano. I don't know if Miles is still here, but can one of you talk about the durable power of attorney and why it's so important again?
Absolutely. And Tom's right. So the trust, in simple, it's a set of legal instructions. You can hold property and assets within the trust. It allows you to, avoid the probate process. Again, Bill's over there. He can probably give the legalese areas, but from a layperson, it allows you to both give instructions and legally through the IRS programs, put certain assets in the trust that, again, can bypass the probate process. Now, totally separately and independent of a trust are the DPAs, durable powers of attorney for both medical and business. Those are legal documents that allow you to designate, authorized, people on your behalf to, make decisions for you. And for those that, gosh, I'm giving away control. No, you can set up your DPs very simply. Well, I'm here and I have capacity, I'm going to be making my own decisions. When I'm not able to, or I'm not available, I'll designate, say, Laura, in my case, my wife. But should Laura and or myself not be either mentally able to make sound decisions or physically be present, I can designate, like Colin, my elder. Colin is someone we trust. When he was little, we couldn't have him there. We had other relatives, but we had to update our trust to have now Colin be our designated DPA person. So they're legally recognized documents. You need to spell out your wishes in your DPAs. And again, they will save you in many ways the hassle, because like I said in my example, you come to a hospital and you're not an authorized person, by marriage, show the DPA, and they'll ask you for that. Oh, okay, you're recognized, you can make decisions for your loved one there. So they are very, very important. Next to that would be, I call the advanced directive document. But DPAs next to your trust, I would say, are very, very important. You never know when or circumstances may change, but you have that down, and you can always change them. They're not irrevocable. So have those. You may have young kids right now, and they're not ready to be your power of attorney. So have someone, a sibling or a parent, they can be your DPAs. But at some point, make sure you keep that updated, because your circumstances may change, or they will change, and then you can have that done with your durable powers. Okay.
This might be a loaded question, but thank you for your presentation. What would be a take-home for a guy that's maybe in their 80s, 70s, or a younger guy like myself in early 50s? What would be a take-home message for me in terms of planning for long-term care or for parents, as we're on their different stages in their life?
Yeah, so I would say the take-home is just to begin the dialogue, if you haven't already. I would say that, having the conversation is important, first of all, at home. And then I think what you'll quickly find is that there are a lot of dynamics that go into the conversation, not only the long-term care conversation, not only the healthcare conversation, not only the financial planning conversation, but I would not hesitate to seek counsel for these types of conversations. So that could be a financial professional, it could be an attorney, it could be a church leader, it could be someone else. But I think the communication is going to be critical for you. That'd be my main lesson today.
And Pete, Nick, again, I think in your family, right, you guys have gone through some experience when there weren't the communications or legal documents right in place. But as Jason just described, number one, it starts with communicating with each other. It's awkward, it's uncomfortable. Some ways you can break through. You get a facilitator maybe to help do some of that. But I know you're really gifted at things, and you can help probably get those conversations going. Even show them a copy to say this outline that we did today. Hey, here's some important things we need to do. But to get what's right for your family will be different probably than what's right for somebody else's. So you're kind of doing like an inventory, family circumstances. Who are the caregivers within the family that are interested, available, and maybe part of that situation? And they're going to change on you too, Pete. When the kids are going away to school, the caregiver team will change. When they're done with school, they're off in careers. Now their availability or capabilities will be different. So it starts with developing a plan, a roadmap, and that works when you have a little bit of knowledge of what you need to do, get some help maybe with that, but then inventory what you have, and some things we talked about today as an example, what you don't have yet, right? So kind of start with that standpoint, and there's critical path, areas that you gotta have, like the trust, the DPAs. Again, you and Miles have been going through that, with Leslie, that, gosh, that would have made things much, much, more efficient, let alone legally. You had better choices to work with. So start with your little inventory of what you have, what's missing right now, then what you have, make sure it's current, and then start filling the gaps with the priorities of things. Long-term care insurance, frankly, it's not for everybody, both from an affordability standpoint and what it will cover. If you do have good infrastructure, it's probably less of an important thing today, and hopefully that infrastructure will be there tomorrow. Part of mine and Laura's long-term care insurance, I tell my friends, I got 3 policies. It's Colin, Jeffrey, Johnny, right? And if they don't do those things, hey, it's part of their inheritance. They've got to help take care. Our other ace in the hole now, my mom and dad's place is now in our CFE that, hey, we get first dibs on the master bedroom if we need it someday. Right? So anyways, different solutions for different families, but start by knowing what you have, what you don't have, and what are the important things to reduce your risk from.
I just want to say, I brought Jason today, and Jason is one of my, his father-in-law is my classmate at USC, go Trojans. But anyway, Jason is an incredible young man. I wouldn't have brought him to our church if I didn't trust him. He's got higher integrity. One of the best things about Jason is he always gives. He's always trying to help somebody. So, he said, well, we talked about this. I said, it's not about getting clients, but it's more about education. But he's extremely talented, and he's very helpful. So if you have any questions, he has to do a great job, because if he doesn't, I just talked to his dad and father-in-law, and he's going to get killed. But I just want to make that comment about Jason. So,
thanks, Dean. Thank you.
I don't know if there's a right answer to this. As parents, our kids know about our finances in general terms, but not specifics? Is that a personal decision, or do you wait till it's the time when they are writing your bills, writing your checks and stuff like that?
So I would say an important dynamic is right now you have the ability to mitigate those conversations. So your kids have a general understanding, and then if they're in a situation where there's long-term care or expenses that they're needing to be involved with, where you're able to mitigate a conversation, then that's certainly not going to be as problematic as if you were no longer had passed away or were not, or unable to be in a capacity to have a conversation. I would just say anytime things are subject to interpretation, it's ripe for it can be problematic. So I would say that having, I think the estate planning process is critical. So having estate documents, like whether it's a trust or a will or whatever, that's going to help to lay that out for you. But I think that and just, I would err on the side of your kids having more information than not.
By the way, congratulations that you've already had some initial discussions about what you have. And by the way, your extra insurance, having a nurse practitioner for a daughter, that's great insurance, another form. And again, Tom's been going through this, and Marcia is a team with his parents. But you never know when is going to be the right time, right? But as Jason said, I'd err on the fact, make sure you have your durable powers, because at least they'll have legal authority, because God forbid an accident happened, trauma happened, you don't have to worry about timing, right? The other side of it, what I did with my mom and dad is we opened a joint account, right? So both Laura and I could be on one of mom and dad's accounts. Plus I had a durable power, so when my mom had her head trauma, I would just transfer assets to our joint account, right, for that. So we didn't have to have A to Z in there, but we had a joint account set up for one of them, and then I had durable power. So since she was incapacitated, we then could maneuver and manage legally her assets. So that way, because we didn't know mom was going to fall down and hit her head, but we had at least a financial foresight, and she was willing. Because again, you lose some control a bit, but she loved me, she trusted me, and we always did the right things for her. So you don't know the crystal ball, but you spoke already about it, you're in the right direction, and you don't have to expose everything. Just list accounts. You don't have to say how much you're in there, but at least they have the legal authority. Then when you're not able to, they can now step in and facilitate or help what you're looking to have done.
And the last thing that you want is a situation where a crisis type situation where something happens, and they're left picking up the pieces trying to figure it out when they're probably not in their right state of mind. They're already probably emotionally charged, upset. They don't really know, and then now they have to sit down and try to sort through a bunch of paperwork, and it's well, this is mine, no, this is yours, and it can be. I would just highly encourage doing some preparation beforehand.
Oh, I got a question. There's a lot of news, in the media that says that 40 million people will be out of insurance in a few years. Now, how does it affect Medicare and Medicaid, and in effect, how does it affect us?
Well, frankly, it depends on what numbers you go to source for, but 24 to 40 for what that's really referring to is the Affordable Care Act, Obamacare, right? Those are people that were now picking up coverage through that program that otherwise would not have coverage. They'd have to go through like the Medicaids and others, but the insurance they're talking about is private insurance, like Covered California. Now let people, instead of only having Medi-Cal, Tom, be their choice, they could go enroll in a silver, gold, or bronze Covered California, like Kaiser, Blue Cross, Blue Shield. So they're able to use funds subsidized by the state to go buy private insurance instead of just having state, Medi-Cal. So that's the audience that, that will be affected by it. And then California right now, I think we're going to continue to keep subsidizing, so there will be Covered California, and you can buy the private options. California, that's why we might be a little bit more expensive, but they're giving their citizens some choice on insurance. How that affects you in the Medicare generation, on a medical side, when people don't have insurance, they can't go to clinics because clinics are required to pay. Whereas where they can go, as I told you earlier, they can go to any ER. What happens, people without coverage start using the ER for basic things because they can't go to a clinic. So when you're presenting with chest pain and you have maybe a heart attack going, you're way back in the line because there's people using it for a clinic. So it'll affect you that way. But from the Medicare program standpoint, that's a whole separate entitlement. I think it's Title 20, and there's Title 19 and 20, I believe, for Medicare, Medicaid. So it's separate. In my opinion, not getting political here, but when we have big deficits in the country, that's being forecasted now for some of the changes, how are we going to solve that deficit? You're going to have to start taking it from pools, right? Where the big pools, healthcare is 20%. So you can guess to go after deficit, you got to look at entitlement programs now. Medicare, Medicaid, they're probably going to take a hit, right? Because we got to find ways to solve it. That's, to me, the bigger risk, not so much the other things for the Obamacare side of it, which doesn't address Medicare.
Listening to this, like a living trust and will, durable power of attorney, and advanced directive, looks like they are very important things to consider. Now, how much can you do it by yourself, or you have to have an attorney, or how much do these things cost if you want to have all these important documents?
I would recommend having a professional do it. It is a legal document, and typically the cost is around, depending what you do, it costs around probably $2,000 to $4,000 to have all of them done. Yeah. I don't know if that's your experience as well, but that's what I see.
You know, again, when neither of us are attorneys, but attorneys are, you know, they're the experts in the legal areas. Again, you could go, again, don't throw anything at me, Bill, please, but you can even go online, right? And they have things you could do, but you get what you get. If you don't understand what you're putting in those things, if you don't understand the, you know, it might have saved you money on the front end, but it could cost you. But so there are resources out there. You can do your own will, your own durable powers. Some things you need to get notarized. So people say, oh, okay, that's a legitimate signature. But in general, with today's technology, there are things you can do. But there are some that charge a lot of money, right? Attorneys, I know ones that I've spoken to and work within the profession, it ranges, as Jason said. So a total package, it's going to cost you a little bit, but it's going to cost you a way lot more if you don't put those things in these legal documents the right way. My in-laws, good intentions, but they were guided down a path. They created what's called an irrevocable trust, because at that time when they did it, it sounded right. But today, Laura and I, it's difficult because they're irrevocable trusts, whereas the common trusts today are called revocable trusts. There's a little bit more flexibility to make changes to it, and the tax laws have changed. You didn't need to today. You don't need to have something to cover up to $5 or is it $10 million now? Before the numbers were lower, so that's probably why they went to irrevocable. So as laws change, I think the right documents, and that's where both a financial planner, accountants, and attorneys can help make sure they're matching up with what the laws are today, but also maybe, in our sense, Laura and I have updated our trust a couple times, but we just did amendments then, because we paid one time to have the core trust done, and then we just make amendments to it, which is a lot cheaper.
And
right?
just to build on that, updating it is just as important as taking that first step. So things change. And so we always recommend that folks regularly update. You don't even necessarily have to update, at least read it again and make sure that everything's still, like, some people will read it like, wow, what was I thinking? That was someone's ex-boyfriend who was in charge of this trust or whatever. So they end up, making an adjustment. So I'd recommend highly, regularly reviewing it, making sure it's up to date.
To be respectful of time, I mean, these are great questions, great conversations. Maybe we'll take one more question if there's a question out there. Any more?
We'll be available afterwards.
Okay,
so
Jimmy.
I've seen like premiums increase every year. Do you foresee that it's going to just be
Jimmy, the insurance market, number one, is based upon what are called actuarials. Pastoral pride, it's about the numbers, right? They look at the risk, they look at the experience during 1 year, and then they spread that in the next year's forecast. So what's happening now, when you don't have as much competition, because there's fewer health plans out there, like we're leaving California because California wanted essential benefits, all those things. Prices go up naturally, but also what's happening too, when you don't have enough people in the risk pool, it's like if you had auto insurance, only had bad drivers, your costs can be real high because the good guy, I don't need insurance. Same with medical. The Affordable Care Act had the mandate, which is now being taken away, where all people must be insured. So it was bringing in healthier people, right, too, but now that's going away, sicker people are going to be in the pool. And what do you think? Logic tells you, and it's happening, premiums are going to start going up. So that's the reality of it. Unless there's enough competition and healthy people coming in medical insurance, those that are getting older, we're going to be subsidizing that. So expect premium increases to go, because you start seeing them flatten out and going down when you had more people coming in the pool, and then those healthy young kids were coming in because they had to. Otherwise, you get a penalty. So likely healthcare costs are going to continue to go up, and your portion, you're going to pay higher premiums or get less benefits. It's a simple equation.
So thank you for that last question. We'll start to wrap up. I want to thank Jason, appreciate it. Tim, round of applause.